Hey everyone, welcome back. Thanks for coming back to watch another one of my updates. I definitely have a few important updates for you all and for those who might be going through this soon. First thing, about 2 weeks ago, I went to go see my surgeon again for another follow-up. He was very pleased with the recovery. Once again, the swelling's gone down very nicely. Still just a little bit of swelling on this side here. That will go down surely over time. And unfortunately, he did give me some, I don't want to say bad news, but news I wasn't expecting. Unfortunately, I I kind of have to wait 8 weeks after my surgery to be able to start eating again. So that brings me pretty much to the beginning of February, within the first week of February before I can start chewing again. And even then, what chewing means at that point is more like French fries, really, really soft, solid foods. So I won't be necessarily treating myself to a steak dinner or anything right off the bat, and that's fine. Um, and it kind of stinks now because I'll be going back to school soon, so I don't have a blender uh, to blend all the food that I've kind of been able to do so here at my house. So it's going to be a little bit harder. I'll probably have to make a lot of pasta um, and just kind of store it in the fridge and take some as I need some. Um, Hopefully, the dining halls will have a lot of mashed vegetables, and I'll just have to deal with it for the first, I guess, 2 to 3 weeks that I'm back in school. So that's that. Again, not necessarily the worst news, but news I wasn't expecting. I was sort of thinking that I would be able to start chewing food about a week after I got back. So basically, about a week from now, I was planning on it, but it's fine. And um, I guess, yeah, a few days ago I went to go see my orthodontist for first time that he's seen me since before I had the surgery. And look, he added two elastics, so one that goes from the top right shark tooth to the lower left shark tooth or canine tooth, whatever you want to call it. And then the other one goes from my top left canine tooth to one of my bottom left molars. So the orthodontist, his part and his job right now is really to get the jaws and the teeth aligned as much as possible and as well as possible. And so you do that with elastics, and so you kind of gauge everything through the bite and the midline. So the bite, as I had mentioned in previous posts, the bite isn't necessarily going to be perfect after your surgery, but that again, that's where the orthodontist comes in and will fix that up. And I have these power chains on top of the some of the brackets, and I had a small gap in the front two teeth, so that helps with that. And it it's it was kind of painful. I don't want to say painful. It was definitely sore. The first night I had to take some Motrin just so that way I could brush my teeth properly. Otherwise, it's really tender. When I was getting the 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 wires off during my appointment, it's important to know that the surgery is, I don't want to say it's rough on your braces, but certainly they do move them around. So I had, I think, 5 broken brackets. So it was definitely painful when they were getting the elastics and the wiring back in, because everything's so tender, and more so with the lower jaw than the upper jaw, and still numb in certain areas of the lower jaw. It's kind of annoying, but it's not numb, it's just tingly, and so I still drool every now and then. That's kind of the most annoying part, but get over it, I guess. Certainly hope I don't drool in class. That'd kind of be a little embarrassing, but I'll figure it out. And again, the surgeon said just make sure that I don't do anything stupid. Try to stay clear of large crowds, places where I get hit in the jaw. And one thing he highly recommended and suggested that when I walk outside, that I walk with my hands out of my pocket, and I am known, sometimes I actually do walk with my hands in my pocket. So that, because it is winter out, and it is slippery in certain areas, it's important, because it's better to get an injury to the wrist or arm than it is to the jaw at this point. So he did say that the jaw at this point is no weaker or no more stronger than before I had the surgery. So that's all I have for now. And I'm sure I'll have another update for you all in within the next few weeks. So thanks for watching, and thank you for your support.